Fundamentally, the issues concerning the chin tip are these. The chin tip might be small. The chin tip can be large. The chin tip can be forward or set back. It can be long or short. Here, at the chin tip, in the XYZ 3 vectors, we can make changes. I can give an example like this. A patient's chin length is normal. However, it comes forward too much, too pointed. Only a shaving procedure is sufficient. Regardless of the problem, we perform almost all of these surgeries from inside the mouth, entirely from inside the mouth. Since we make no external cuts, you won't have scar issues. Let's say I'm giving another example. The patient's chin tip is pointed forward, and when we look at the height, it is long. In that situation, for such a patient, by filing down the chin tip and removing a small piece of bone from the chin bone, we can achieve the correct height. And we can also move the forward pointed part backward. Thus, we can again achieve a successful result. Another example, the patient's chin tip is set back and short. In this case, using an implant on the chin tip, we can solve this problem clearly. Sometimes patients do not want foreign material used. In this case, especially if we are not going to use an implant, the bone stock in the chin tip area. If our bone stock is sufficient, by making an incision on the bone at the chin tip, we can use the patient's own bone tissue to move it forward, downwards, meaning in all 3 vectors. We can make aesthetic alterations to the bone, consequently chin tip aesthetics. It is surgery done entirely inside the mouth. Surgery time is about 30 minutes to 1 hour. You might even go home the same day. You can resume your social and professional life within 1 week, achieving a perfect outcome.